We live the same day every single day, knowing what happened and the people that did it are living their lives. I spent Christmas with one less person to hug.
16-year-old Ariana Casada and her mother came to this RCMP detachment in High River to press them to investigate her father's death. Benito was 51 and supporting his family by working at Cargill's meat processing plant. It was deemed essential and kept running as the pandemic spread across Canada. Hundreds of workers became infected, including Benito, who died only weeks later. The family alleges Cargill didn't do enough to protect its workers by supplying proper masks or ensuring distancing.
Cargill, even though it's worth millions and billions of dollars, it's not exempt from the law.
Cargill says it's not seen the criminal complaint, so can't respond directly, but wrote, "The safety of our employees is our top priority," and that Cargill has operated in a manner that meets or exceeds the federal government's health and safety standards. The RCMP confirms to CBC News it has now opened an investigation, believed to be the first criminal probe in Canada into a COVID death tied to someone's work. Usually, police defer to provincial labor officials. But that's part of the problem, say some experts, who say the system in the early days of COVID collapsed, with inspectors unable to properly get inside to monitor workplace health and safety.
I think the COVID pandemic lays bare, and is going to continue to lay bare, the fact that many workplaces are dangerous, that there are risks taken with workers' lives, that the regulatory system that we have in place is insufficient to deal with these risks.
Leaving Ariana and her family hoping that police can deliver some form of accountability.
There's not a moment that goes by that we don't think of him, and I want all the people at Cargill, especially the authority figures, every day when they go to work, to think of him every single day, because every single day I have to live with the fact that I don't have a dad anymore.
CBC News has found 3 other cases where complaints were filed with police. In Ontario, 3 frontline healthcare workers who got COVID on the job and died. Their union accusing the employers of criminal negligence. Police did not step in those cases, and instead they deferred to provincial labor inspectors, whose penalties would be far less severe. Those investigations remain ongoing. Dave Seglin, CBC News, Toronto.
Okay, now let's bring in infectious disease specialist Dr. Suman Chakrabarty, because Dr. Chakrabarty, I think the Cargill case raises all kinds of important questions in a broader sense, right, when it comes to where this virus spreads. So what does it suggest to you about, I don't know, where we ought to be focusing our attention?
Yeah, it's a really good point. I think that we have an appropriate focus on what's happening in the community, what we can do in our households, things we can do to keep safe. But I think one area that requires a lot more focus is what's happening in many essential services, such as factories, food processing plants. We're seeing infections happen there, but the big thing is these infections can then be brought home. And statistically, many people who work in these industries have large households. And you can see a very significant amplification of the infections when in that situation. And that can really be a driver of what's happening. So, this is a thing also that's very important to note, that the lockdown is not going to affect this, and you have to look at it more specifically with different types of interventions to help bring the cases down in that sector.
So very quickly, what would you expect provinces to do with that knowledge and that awareness? I mean, what could they do?
A couple of things: keep the workplaces safe, mask, physical distancing, paid sick leave, so people aren't afraid to come forward, because if they have to go off work, they won't lose wages and they can still pay for essentials. And an isolation center, places where people can go to isolate away from their family, and that helps to break the chains of transmission. There are other things as well, but these things are much more effective than a lockdown for this sector. I think it's important to consider, and I hope the government does in the next couple of days to weeks.
Dr. Chakrabarty, thank you very much.
Thanks for having me.